Okay, so we've seen that the Sally Ann test seems to reveal a deficit in autistic individuals. Autistic individuals, even 12 years old, are responding to the test like 3-year-olds. And remember the critical question down here, where will Sally look for her marble? That critical question requires that we understand that she have a false belief. She did not see the marble transferred from the basket to the box, so she will look in the basket where she thinks she left it last, but the marble's actually in the box. So we talked about whether maybe autistic individuals and 3-year-olds maybe don't sort of understand the questions, they don't understand the story well, but the reality question is answered correctly. Well, maybe they have trouble with memory. They don't remember that the marble really was in the basket, but the memory question, autistic individuals answer successfully. The problem seems restricted to understanding that the belief has become false, right? So the belief is out of date. But there is another possibility. It could be that down here at the critical question moment here, where we ask, where will Sally look for the marble, the subject of the experiment, either the 3-year-old, the 5-year-old, the autistic individual, knows the actual state of affairs. They know that the marble's in the box. And maybe that is difficult to suppress or inhibit that response. So while we're asking, where will Sally look for the marble, the knowledge that the marble's actually here might be difficult to inhibit. And so maybe the reason why autistic individuals say that she will look here, like 3-year-olds, is that they have difficulty inhibiting that response, where the marble actually is, that they themselves know. So to test this possibility, we'll go to the picture task. Now, the picture task can be seen, again, sort of a scenario, a sequence of events here. Here we see an individual taking a picture of a bedroom scene, and we have a cat sitting on a chair in the bed here. And this camera is one of those old Polaroid cameras. So you take a picture and the film comes out, and then it develops right before your eyes. But notice what's going to happen here. The researcher here is going to move the cat from the chair to the bed. So kind of like in the Sally Ann scenario where the marble goes from the basket to the box, the cat is going from the chair to the bed. And then the question will be asked, in the photograph, where is the cat, right? So this person is going to have to understand that the photograph that was originally taken now is out of date. The world has changed. The photograph hasn't captured that change. So how do autistic individuals perform on this task? Take a look over here. Here, false belief task, like the Sally Ann task. Here's the what we might call the false photograph task. Autistic individuals perform very well on the false photograph task. Now, normals are shown here. Why the autistic individuals are outperforming the normals, we're not going to get into, but the clear difference in performance between the photograph and the belief task is striking. It seems as if autistic individuals have a specific deficit in representing beliefs that are out of date. So it's not a working memory issue. It's not that they can't represent that something has changed, because they understand that the picture no longer captures the reality. In fact, the cat in the picture is going to be on the chair, even though the cat in reality is on the bed. So autistic individuals can understand the task in the false photograph task, but not the false belief task. Again, that was an interesting finding, because it says that it's not really a working memory problem, and neither is it a response inhibition problem. So in other words, the subject sees that the cat really is on the bed, but they correctly say that the photograph will have the cat sitting on the chair. Now, back to the tests like Sally Ann test. We said that autistic individuals are delayed. They're delayed in language acquisition. They're also delayed in their ability to pass the Sally Ann test. So the red squares here would be typically developing children, and they start to, over half of them start to pass the test at 40-something months, right? But it isn't until 8 years old that autistic individuals can pass the Sally Ann test at rates that are equivalent to 4-year-olds of typically developing children. So there's a delay in the ability to pass the Sally Ann test, just as there's a delay in language acquisition as well, and language competence. Now, Frith argues that this is curious. A couple of puzzles here. Why do autistics who can solve the theory of mind tasks like Sally Ann, they still have social communication problems? They have difficulty understanding sarcasm, jokes, teasing, right? So even though they might be passing this test, which seems to require an understanding of mental states like beliefs, they still have social communication deficits, social understanding problems. And furthermore, how are some autistics able to pass the false belief? So even some young autistic individuals can pass the false belief test. How are they doing that? She argues that what's happening in autistic individuals is they are using other learning processes to master this task. And so she'll ultimately come to a conclusion that typically developing children have a sort of an intuitive system that allows them to understand the mental states of others that autistic individuals lack. They lack the intuitive system, but they can work it out deliberately, explicitly. They can figure out how to pass these types of tests, not using intuitive systems in the brain, but they can work it out. And so they learn how to pass those types of tests using what she'll call compensatory learning processes. So even though they can still pass the test, Frith is going to argue that kind of makes the point that what they lack is the intuitive systems to pass the test early. They have to work it out later as they gain more experience in social environments.